I'm Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado, and this is my client Avril. And he was treated some time ago, several months back, maybe 6 months back, and treated successfully. And he was laying on his back, hugging his right knee outside of his shoulder. And the dog suddenly jumped on him and hurt his low back and right sacroiliac region. And it's unusual to see someone present with a sacral torsion in prone, but he does present with one prone. Usually they get worse in flexion, and the client may present with a symmetrical sacrum in prone, but if they have a torsion, it happens in flexion. So upon sitting, you see the asymmetry. And a sacral torsion about an oblique axis means that there's an oblique axis. This happens to be the left oblique axis because it starts up on the upper left part of the joint, whereas the right oblique axis is this way. And so the sacrum rotates and side bends about that axis. And what we do to evaluate the sacrum is we draw a line straight down the middle of it, and this is the boomerang-shaped cartilage of the joint, of the sacrum. Okay, and you have one on each side. And so you draw a horizontal line across the middle of that boomerang shape. So you draw a line across it, and that gives you with 4 quadrants of the sacrum. And so what we do is we test passive motion on the upper right quadrant, upper left, lower right, and then we come underneath it and we test side bending in each direction, and we also test the big sacrotuberous ligament. And I know that the camera is not going to be able to see the asymmetry that he presents with. The ilium is right here. That's the bump called the PSIS. And this is at the second sacral segment. And now my thumbs are on the first sacral segment. And as we walk down the sacrum, and I think the camera might actually be able to capture this, but can you see that this left thumb is higher towards the ceiling? Is that visible on that? Okay. And the other thing you'll notice, and that continues through the left lower quadrant, the other thing is that when we come underneath it, you want to come sideways, please. You might be able to see that this is much lower. So the sacrum is rotated such that the left lower quadrant is prominent, and it's also side bent to the left, so it's lower under the left inferior lateral angle. So if I try and create movement through the sacrum, I can see his head bob up and down because the force goes through that joint. And if I come on this side and I use the same amount of force, a reasonable amount of force, there's no movement. Now if I put 60 pounds of force, maybe it'll move. But when I put a reasonable amount of force between 15 and 30 pounds, I get movement through his whole body on the right, and we get blocked mobility here on the left. And if I spring forward on the left lower quadrant, it's stuck. If I spring on the right lower quadrant, it moves. And then I spring on the right upper quadrant, it moves. And if I spring on the left upper quadrant, it moves. Now I can also capture the spinous process of L5. And I'm springing it to the right. And then I'm capturing the spinous process of L4, springing it to the right. And now when I try and spring it to the left with the same amount of force, it doesn't move. Okay? So there's no doubt that when you have what we call a sacral torsion, a twisting pattern of the sacrum, you can see it connects to the L5 vertebrae. These are the lumbosacral facet joints. And these joints are also involved. And in this example, the sacrum is rotated this way to the left, and so is the L5 vertebrae. So you might also call it a lumbosacral facet joint problem. That would be a reasonable terminology as well. And the other thing I want to point out is that the sacrotuberous ligament, which connects between the inferior lateral angle and the sit bone, the ischial tuberosity. So it's shaped like this, but it really fans out. It's quite a wide ligament. When we come across it, I can indent it freely, okay? And it's become softer because the sacrum is side bent, so that basically passively shortens that ligament, okay? On the right side, the ligament is lengthened and it feels like a bone. It's very stretched on the right side such that it feels like a bone. Now, the treatment I'm going to use is going to be very straightforward. I'm a real fan of this open cell foam. This is 2 inches tall, 4 inches wide, 8 inches long. And I like it because it gives a little bit and conforms to the shape of the body so it becomes more comfortable. All I'm going to do is place this across his lower sacrum. And I'm going to have him lie on his back, and he'll lie on that for 5 minutes with his hips and knees bent for comfort. And after that, we will come back and retest it. And I'll see you in 5 minutes. Thank you.